Hello, everyone, and welcome to the AMTZ Podcast Series in collaboration with Medgate Today, where we bring you conversation with experts shaping the future of healthcare, science, and medical technology. Today, we are honored to host Dr. Arun Mullaji, one of India's most respected experts in musculoskeletal healthcare. Dr. Mullaji is a joint replacement surgeon associated with Bridge Candy Hospital and Hinduja Healthcare and serves as a surgical director at Mullaji Knee Clinic. It's a pleasure to have you here, sir. So why don't you tell us something about musculoskeletal healthcare?
So first of all, thank you very much yourself and Jitendra ji for inviting me here. This is beautiful campus. It's an amazing place. Having said that, I am a practitioner of orthopedic surgery, hip and knee surgery mainly. And musculoskeletal healthcare really pertains to bones, joints, and spine issues. And it covers a huge age range: arthritis, osteoporosis, conditions affecting their bones, joints, spondylitis, their spine. It comes to the younger, more active people who are involved in sports, who are involved in road traffic accidents, injuries, sports injuries. And also it comes down to real kids, the pediatric age group, although typically pediatric surgeons are separate from the orthopedic surgeons, or they're more specialized. So it's basically broadly dealing with painful hips, knees, shoulders, back issues, and so on. Arthritis, osteoporosis. So these are some which are very acute conditions, but they can also be some very chronic conditions.
Since we are talking about, or this particular podcast is more about science and technology, so I would like to talk more about the medical technology advancement that has actually transformed the sector. So what is your take on that?
Yes, so for a long time, we orthopedic surgeons were supposed to be very skilled at using a hammer. We found everything was a nail and we would just hammer things, use plasters and so on, mainly dealing with fractures. And then as technology has now stepped in, we are doing more and more advanced things. We are using computers, we are using robots, we are using telescopes, endoscopes to go into small joints, including the ankle joint, the elbow joint, shoulder joints, and through small portals we can see inside the joint. We're able to completely replace the entire hip joint, the knee joint, often through such a small cut. For example, we do a hip replacement in the morning, by evening the patient's ready to go home. We don't cut anything other than the skin. So the technology has improved, the techniques have improved. We have the ability of technology to help us in terms of robots, computers, imaging techniques. CT scans have improved, MRI scans are now available, contrast MRIs. So there's a convergence of technology from different fields. And our own parallel fields like radiology, for example, have contributed a great deal to our improved knowledge of bones and joints. So that allows us to really give a much better outcome to patients with not only acute but also some of the long-standing chronic ailments that people have.
Okay, so if I can say that it has improvised the detailing of any kind of ailment or a pain that a patient is going through. It has improved the precision level of any ailment in a patient.
Yeah, that's absolutely true. So if you see, the evolution has been in the following manner. It started off with more an intuitive method of treating people. I think this person has, let's say, fever. To give you a general example, this fever, and I think intuitively that it may be a viral infection.
Okay.
So that was the intuitive form of treatment. Then it became more empirical, where you'd have a few blood tests and you do the WBC count, the white cell count, and say, okay, this is raised, so probably it's not viral but could be bacterial. So it was more empirical. So I'll treat it with antibacterials or antibiotics.
Okay.
Now it's becoming more and more specialized. It's becoming more and more precision based. So now we are able to say, okay, I think this fever is because of this bacteria. And this bacteria is sensitive to these antibiotics. So it's precision.
Yes.
And now it's gone to the last level. That's the highest level, which is personalized. Personalized in the sense now, because these 4 antibiotics may work for this particular bacteria, but you may be having a problem with one of those antibiotics. Therefore, you should not be given that, but instead of A, you should be given B.
B.
Because A may be affecting, let's say, your kidneys.
Yes.
So therefore, it's become personalized.
Yeah.
So that evolution is now occurring not only in general medicine,
Yes.
but in our field as well.
Yes.
So we've taken it from simple X-rays to CTs to
Yes.
MRIs,
Yes.
and it's gone on ascending
Ascending.
to a very high level.
Level.
So that now our diagnosis has got better, more precise.
Yes.
Our management of these conditions has become more precise.
Yes.
So a lot of these technologies are converging.
So we can say that because of the advancement of the technology, the diagnostics have improvised. And because the diagnosis is improvised, it's easier now to rule out the condition in the patient, the ailment in the patient, so that the specific and precise medication can be done and treatment can be given, right? So so moving to next, like how this amount of accuracy and precision and advancement in technology has helped the patient recovery.
So naturally, when you target a patient and you know exactly this particular patient has these features, and you're treating that person as a person and not as a general mass of public with that condition, where again it becomes more empirical, that you're treating in general. If you're treating a fracture of, let's say, the hip in general, this is the result. But now when you're treating this particular patient, you're taking into account a lot of other factors which are specific to that patient. And you're saying, okay, now I know his bone density. I know that he's suffering from this other condition. I know that this is his heart condition. Now I'm putting all these factors together and saying, for this guy, this is the best treatment.
Okay.
You followed?
Yes.
So we are narrowing it down to a very, very specific way in which I would treat this person, which may be totally different from the way in which I treat the next guy with the same fracture.
Yeah.
But completely different treatment.
Completely different treatment.
So that's called personalized medicine and surgery.
What are the key technologies and technological trends that you see in this sector in terms of rehabilitation?
So in terms of rehabilitation, firstly, a lot of emphasis used to be placed on physiotherapy, particularly, let's say, after a knee replacement or a hip replacement. And that used to be more worrying to the patients, who would be concerned about the pain that they would undergo after the surgery. They were not so concerned about the surgery, they were concerned about the pain of the physiotherapy and the exercises that they would have to do.
Yes.
Now what's happened is that the first step of surgery itself is minimally invasive.
Yes.
You cut hardly any or no muscles. Therefore, they don't really need that much physiotherapy. So the need for physio has in one way reduced. On the other hand, we are having much better methods of improving patients' recovery in terms of feedback, providing them feedback in some manner, collecting data from them in terms of sensors. You have these, like for example, your watch will tell you how many steps you've taken in a given day. So you're now getting metrics on their performance after surgery. They are also getting those metrics. Now we are having the ability to place sensors and wearable devices which are given to the patient after surgery. So that you're seeing, okay, now I've given this particular device for the knee, and I'm seeing that this patient should have got from this much 0 to about 100 degrees of movement by now, but he has only 0 to 60. So there's something wrong somewhere. So the physiotherapy is also getting more targeted. You're getting more and more precise with the recovery pattern. Earlier you would have missed it. You would have come back after 2 months with a stiff knee after surgery. And then that would be too late. Here now you're able to preempt a possible problem because of, again, technology helping us in getting that information from the patient. Now, of course, there are more and more devices which are available which can assist people who have weak legs, like those who are paralyzed. You have these exoskeletons which can help them to get up and walk, which was previously never possible for these people.
Yes.
So that is another area in which physiotherapy is helping.
Helping.
Not only that, we have gait labs and gait analysis,
Yes.
whereby you can get a lot of accurate information from cameras, from sensors on the foot plate. So you know exactly how this patient is walking, where is the problem in the gait, which muscles are not working, what needs to be improved. So even physio is getting better.
Yes. So really interested to know, like, how do you handle, because, I'm sure that they are not all similar. So you get all different kind of patients. So how do you respond to that? And or how the patient respond to such rehabilitation or post-surgery, mapping that is done?
Yeah, so that's a great question, because we see a whole variety of people of different age groups. They have a different starting point, but you want them all to have the same end point, which is that they should walk or
Yes.
have their normal activities of daily living perform perfectly without a limp, without pain, without falling down and so on. So to achieve that, where the starting point is so variable, and then bring them all to a fairly narrow spectrum of recovery, is quite challenging. And it again needs that same attention to detail and differentiating one from the other, seeing what exactly a particular person requires as against the next person. Where is the deficiency? What is the problem? Is there a muscle weakness? Is there a nerve issue? Is there a technical issue with that person? Is there a lack of motivation? Is there a question of fear? Some of these patients are quite fearful. Oh, I didn't want to take a chance. I didn't want to do this. I didn't do that because I was worried. So, perhaps lack of communication.
Yes.
All of these combined. So, you have to treat a patient individually.
So
That's a short answer.
Yeah. So for that individual attention, you rightly said that lack of communication. Since I'm from a communication background, I would really like to know, what are the trends or what are the kind of such communication in healthcare you think that can be made or made available for patient, that these things becomes easier for doctors?
Yes.
They can, the response of the patient becomes, or acceptance towards such emerging technologies becomes easier for the patient, so that you can have a less challenge while handling.
Yes. So, fortunately, what's happening is there's something called word of mouth. And the patients themselves are the best ones who either give you a good name or a bad name. It's generally the ones who are very happy that they'll go and tell their friends, neighbors, etc. that look, I did this surgery and I'm perfectly okay. Next day I was walking. I didn't need any physiotherapy. That's completely different from somebody else.
Yes.
Who might be in a completely different situation where they have heard horror stories. They're extremely negative in their approach. They're apprehensive. So each one, as I said, needs to be dealt with in a different manner. And some of them will need more intensive physiotherapy. They'll need more monitoring. So what we do is we do email consultations, we do video calls with these patients. And at periodic intervals when we are worried, we'll just tell them, send us a video of how you're walking, how you're bending your knee, are you able to straighten it fully? So we are getting all this now. This was not possible in the past. Everyone has a good phone.
Yes.
They take a video, they send it to you.
Yes.
They send pictures to you. So immediately we are getting this feedback from the patient that yes, they're doing well or no, they're not doing well. Plus, you can then focus on training them over the video. So we do a video call with them, and our physio or one of our colleagues will analyze their gait, make them walk at home in their home situation. How are they getting up from a bed? Are they struggling to get up? Which implies that maybe they need a little strengthening in certain group of muscles. So then you tell their physio that this group of muscle needs to be strengthened. This patient will get up from a bed or a chair easily. Somebody is having a problem ascending or descending stairs. Then you know, okay, this is the problem with this particular person. Therefore, now focus your attention on this. There's no point doing 20 exercises which are generalized. You just do specific targeted physio for that person. So again, technology has helped. The ability to use phones, emails,
monitoring.
pictures, all of that can be done live now.
Yeah.
Earlier, pre-COVID, the government didn't allow us to use WhatsApp, and you couldn't message on WhatsApp. We were not allowed to,
Okay.
tell patients anything on
WhatsApp.
social media. But now it's so easy. They are not. In fact, in COVID, it was encouraged that you talk, send pictures, videos. So now that's become a very commonplace
Yes.
method of treating patients.
Yes. A constant monitoring system. That is what is required post surgery. That is what you're saying.
Yeah, so now a lot of these sensors are available, a lot of these wearable devices are available, which will tell you, the patient themselves come and tell you that, oh, in my first week I walked 3,000 steps, in my second week I walked 6,000 steps. So simple measurements on their watch or on their phone can tell them a lot.
A lot.
And now these wearables are available, which will give us and them information that there's feedback occurring. That today I could bend to 40, tomorrow 50, tomorrow 60, and so on. So that feedback loop is very important for them.
Definitely encourages them.
It encourages
to
them.
do that more. So that was actually my next question. That how do you see the wearables actually forming the future of orthopedic?
Well, it's not the future of orthopedics, but it's an integral component of monitoring the patients after the intervention that they've undergone to make sure that their recovery is as predicted, that there is no hiccup in their recovery, there's nothing going haywire, that they're following the pattern as expected. So it's only part of the component. And as I said, the better the surgery is performed, the less the need for monitoring and the less the need for physiotherapy. So that also goes hand in hand.
Yes. So how important are patient-specific implants and additive manufacturing in orthopedic care?
Okay, so these are again great questions because we are in AMTZ and therefore it's important to talk about all this. Now, these are great advances which have occurred in the last few years. Most of the time, it's like your footwear, your shoes. You don't need to have custom made shoes. You can go to the store and take the regular size shoes, and that's it. However, there will be occasions where somebody has a foot which is completely deformed, it's a different size, shape, where a normal shoe would not fit. Those are the ones where you would need custom implants. Secondly, if somebody has had an injury, a fracture, it's completely deformed and therefore will not conform to the normal sizes. Or if somebody has had surgery, severe bone loss, or loss of bone due to tumors like bone cancer, where a part of the bone has been removed, these are the ones where you would require to put in a custom implant.
Okay.
But as a rule, they're not needed routinely. Okay, there's no great benefit. There were a few companies doing this overseas, and unfortunately, they're not doing very well because there isn't really a need for this. It's a great nice to have, but it's not, must have.
Must have.
On the other hand, 3D printing is very important. When we are doing what is called revision surgery, now hip and knee replacements, for example, have been there for many years, many decades. So we are now seeing people coming back after 20 and 30 years of surgery. And that has had its toll on the bones and the soft tissues. So when we remove these and put a new implant, there is some degree of loss of bone tissues around the implants that had been put 20 years ago. Now, for implant manufacturing companies to have each possible combination and permutation of the bone defect to be filled with an implant is not practical. And therefore, for a given person with a given defect, you can do a CT scan and you can determine the exact shape of bone defect and 3D print that defect in a material which will be useful, which we know is inert, and which will integrate with the bone very well. Substances like titanium, for example, with a very rough surface, will integrate into their host bone, so well that it becomes part of their system. So therefore, 3D printing has suddenly transformed the world of complex surgeries and made it easier now for us to deal with such patients, because a one-off thing, no company is going to manufacture that for you. It's going to take weeks. With 3D printing, we can get it in 2 weeks or even less now. And you can have that implant with you, use it for that patient, that's it.
That's it.
It's amazing for the appropriate conditions.
Yes. So now, from a patient's perspective, how a patient should choose, like, what implant is good for him or her? Like, especially, we have a thing like these are international brands or Indian brands. So, how do you see that, a patient makes an informative choice of such implants?
We often have this issue with patients coming, they go through the internet, they've gone through all sorts of stuff on
Yes.
the net, they come out with 30, 40, 100 pages of printouts, and then they start asking you these questions. So the way in which I answer them is this way, that if you've done adequate research, then you tell me what you want me to implant, I will put that in. Or you leave me the choice and I will do what's best for you based on my training and experience.
Yes.
These are the two choices you have. Right? Take it or leave it. Because when I go and take my car, for example, to the mechanic,
Yes.
and he tells me there's some problem with the carburetor or radiator or whatever, I'm not going to tell that guy, I want this particular carburetor and this particular radiator of this brand of this size. I don't know anything about that. I'm not qualified to make that decision. What I should choose is the right guy for the job and tell him, now you do what's right for me.
Yes.
That's how I would approach it. If I have a problem, that's how I approach it. I don't go and tell my doctor who may be administering medicine for me, let's say for a lung problem. I've got a bad, let's say, throat infection or a chest infection. I'm not going to tell the chest surgeon or the chest physician, do this test, do that test, give me this antibiotic, not that antibiotic. Then he'll say, go and do it yourself.
Yes.
I'm the expert. Why are you coming to me?
Yes.
If you're going to tell me all this. And similarly, I would say that you're not going to tell the mechanic what gadgets to put into that car.
Yes.
So why would you want to tell the doctor who's highly specialized, highly trained, who's aware of
Things. The situation.
complications which the patient may not be aware of? Patient has not read all the papers, not attended conferences, he's not updated himself. But the doctor is relatively, if he's gone to the right guy, that guy knows what's good for him.
Yes.
And leave the choice to that person. Choose the right doctor and then leave the choice to him.
Yeah. Very rightly said. So, trust the doctor. That's very important. So, because you have already chosen. So, trust the doctor and leave that on the doctor to choose it for you. So, since we are in AMTZ, and we are into indigenous manufacturing, so definitely, do you see that there is a lack of interest from the doctors to choose indigenous products?
The answer to that is historically yes, because for many years they were not available. So that was the first point. Then they started becoming available. The problem with the availability in the earlier years was that there was no facility to test these implants. For anyone to tell us that this implant is equivalent to an implant made by another company from overseas. So how is this doctor going to take the responsibility? Because tomorrow, let's say, and we've seen this happen, the implant fractures. The patient is going to hold the doctor responsible. That he's not going to go and chase the manufacturer of that implant. He doesn't even know who the manufacturer is, right? He's going to chase the poor guy who's put it in. That guy has done it in good faith, right? Now that's where the problem is. Now, if you have very rigid standards which are enforced, and you say that these are international standards and the implant meets these international standards, there's no discussion.
There's no discussion.
Then obviously you would use a product which is easily available. And why not then use what is Indian? So what we are doing is I'm working with certain manufacturers, Indian manufacturers, to try and get implants which are of the appropriate size for our population. One of the downsides of using implants from overseas is that they are not necessarily made for our patients' bone size, quality, and our cultural habits of sitting, kneeling, sitting cross-legged on the floor. These sort of activities, they're not designed for it. So if we can have Indian implants which are more suitable for Indian patients
population,
of the appropriate size, shape, which fit us better, why would any Indian surgeon not use it?
Yes.
Assuming that they have been properly tested manufactured properly and tested properly
Yes.
for equivalence.
Yes. So, very rightly said that the culture, the geography also influences the technology that we are advancing in. So, how do you see that, the kind of collaborations from the side of clinicians and manufacturers that is required to advance more in the technology?
I think this is a fabulous question you asked, and one of the reasons I've come over here is because when I first spoke to Dr. Sharma, I got the impression that this is a place where there will be some interaction with clinicians that it's possible with the engineers out here. Because generally, what happens, and we've seen this, and I've interacted with engineers from other companies because I've been involved in design of implants, instruments, software for computer navigation. And I found that most of these people don't take into account the surgeons, the end users' requirements and needs. They will do what the engineer thinks is appropriate. And then we have to fight with these guys and tell them that, look, we are doing the surgery. This is what we want. It's not what you want. It's what we want that's important. And unless they accept that, the products are not going to be used and they're not going to be useful. They'll be just lying there on the shelf.
Yes.
So that's where the key question is. The clinician's involvement is so important because he's the end user. It's like saying you're designing this office for you. The interior guy says, no, I want this chair here, I want this here, I want there, but you don't want it there. You don't want to be facing the door. You want to
Yes.
have some privacy. You have your own ideas of what should be where.
Yes.
If the designer is telling you, you're going to say, no, I don't want it this way. The same thing, when you are working together with engineers and designing instruments, implants, the end user is the key out there. Unless he's consulted, with his experience and knowledge, he can immediately say, this is not a good idea. Don't go down this path.
Yes.
So that dialogue and interaction is
Collaboration,
so
yeah,
critical.
so critical.
And if both are, working in sync with each other,
Yes.
then you'll have a fabulous product at the end.
Yes.
It's bound to happen.
Yes. So collaboration is the only key between the clinicians, the technology people, the engineers, and the manufacturers. So thank you so much, sir, for all the insights and being here and sharing your knowledge and insight with us. And looking forward to more. And let's see that what AMTZ and our doctors can do together. And so for more information, you can write to us at info@amtz.in and stay tuned for more. Thank you.